Hey, future RN. The head-to-toe assessment is, without a doubt, one of the most important skills you are going to use every single shift. And guess what? It is tested heavily on the 2026 NCLEX. So today, we're going to cover the full systematic approach, all the step-by-step details, and most importantly, the real purpose behind it all, so you can perform it with confidence and spot problems early. You've totally got this. Let's master it together.
Welcome to ClearPath NCLEX. This is your go-to channel for high-yield content that's actually going to help you pass on the first try. I am so glad you're here.
And hey, if you find this explainer helpful, do me a favor and give it a like and subscribe for more high-yield NCLEX content. Oh, and hit that bell so you never miss the next game-changing tip.
Okay, let's dive right in. Here's our game plan for today. First, we're going to talk about why this assessment even matters. Then we'll walk through a detailed step-by-step guide. After that, we'll test our knowledge with a few NCLEX-style questions, and to wrap it all up, I'm going to leave you with a final cheat sheet you can use for your review. First things first, let's talk about the why. Understanding the purpose is what separates a nurse who's just checking off boxes from a nurse who is a true critical thinker. And trust me, that is a huge NCLEX skill. So here's the bottom line. This assessment is the absolute foundation of everything we do in nursing. It's how we figure out our patient's baseline. Without that starting point, how can we possibly know if something is changing for the worse? This helps us catch those tiny signs of deterioration super early, identify problems before they become a full-blown crisis, and then build a care plan that's perfect for that specific patient. It all comes down to patient safety. Now, pay close attention to this slide because this is a rule the NCLEX loves to test. For pretty much every other body system, the order is inspect, palpate, percuss, then auscultate. But the abdomen, it's the special one. We inspect, and then we auscultate before we ever touch the patient. Why? Well, because if you start pushing on the belly first, you can stir things up and get a false reading of their bowel sounds. So remember that order. Inspect, auscultate, palpate, percuss. All right, let's get into the heart of it, the systematic guide. We are going to walk through this piece by piece, from the very first moment you lay eyes on your patient all the way down to their toes. Your assessment literally begins the second you walk into that room. Before you even say hello or touch the patient, you are already performing the general survey. You're just observing. You're looking at their appearance. Are they well-groomed or do they look disheveled? How's their hygiene? Their posture, are they sitting up straight or are they slumped over in bed? You're also taking note of their mood. Do they seem calm, anxious, maybe a little agitated? Then you'll check if they're oriented by asking their name, where they are, the date, and what's going on. That gives you alert and oriented ×4. And of course, you'll get your vital signs. And, so importantly, ask them to rate their pain on a scale from 0 to 10. But just getting a number for pain isn't really enough, is it? To really get the full story, we use the mnemonic OLD CARTS. When did it start? That's onset. Where is it? Location. Is it constant or does it come and go? Duration. What does it feel like? Sharp, dull, achy? Characteristics. What makes it better or worse? Aggravating or relieving factors. Does the pain travel anywhere else? Radiation. What have you tried for it? Treatment. And finally, what's that number? Severity. A really thorough pain assessment is just non-negotiable. So here is the basic roadmap we're going to follow. As you can see, it's a super logical flow. We start at the head, we move down systematically to the neck, chest, heart, abdomen, and then finish with the extremities. Following this exact order every single time is what keeps you from missing something important. It builds that muscle memory and makes sure your assessments are always thorough and reliable. Okay, let's break down each step. Okay, let's kick it off at the very top with the head, face, and eyes. So you'll gently feel the head for any lumps, bumps, or any tenderness. Then take a good look at the face for symmetry. This is a huge indicator for a potential stroke. Is one side drooping? Next, for the eyes, you're checking to see if the sclera is white and the conjunctiva is nice and pink. And this right here is a key neurocheck, PERLA. Are the pupils equal, round, and reactive to light? And do they accommodate? That just means, do they constrict when the patient focuses on something up close? This one simple check tells you a ton about their brain function. All right, now that we've covered the head, we're going to continue our systematic journey right down the body, focusing on the neck, the chest, and the heart. These three are all really closely connected, so it makes sense to assess them in a logical sequence. For the neck, here's a huge safety point. Always palpate the carotid arteries one at a time. If you press on both at the same time, you could actually cut off blood flow to the brain. You'll also look for jugular vein distension, which is a key sign of fluid overload or even heart failure. For the lungs, first just watch them breathe. Is it easy or does it look like hard work? Are they using extra muscles in their neck to breathe? Then you'll listen to all the lung fields, front, back, and sides, to make sure the sounds are clear. For the heart, you'll listen at all 5 key points on the chest. And don't forget to count that apical pulse for 1 full minute to be accurate, especially if the rhythm sounds a little irregular.
We are on the home stretch of our assessment. Now we're moving down to the abdomen and the extremities, and then we'll wrap it all up by checking the patient's back and doing one last check of their neurostatus and skin.
Okay, for the abdomen, I'm going to say it again. Remember that critical order. Look, listen, then feel. For the arms and legs, you're checking circulation by feeling for pulses and checking capillary refill. It should be less than 2 seconds. You're also looking for any swelling or edema and testing their strength by having them push and pull against you. And please don't forget to have the patient turn over so you can check their back for any skin breakdown, especially over bony spots like the tailbone. And just remember, the skin assessment isn't just one step at the end. It's something you're doing constantly from the moment you first walk in.
You are doing so great. You have the theory down, so now it's time to put it into practice. I'm going to throw a couple of NCLEX-style questions at you to really make sure this information sticks.
Okay, first question up. You're getting ready to assess a patient's abdomen. What is the correct sequence you should use? Take a second and think about it. And the answer is inspection, auscultation, palpation, and percussion. And the why here is so important. We listen before we touch because pushing on the abdomen can stir up activity in the bowels. That can make you think bowel sounds are present when they aren't, or that they're hyperactive. You always have to listen first to get an accurate picture. All right, next question. While assessing the neck, you notice the patient's jugular veins are full and visible. What body system is this finding, JVD, most closely tied to?
That's exactly right. It's the cardiovascular system.
And this is a perfect example of how one little assessment finding points to a much bigger picture. JVD suggests there's increased pressure in the venous system, and that's often because the heart isn't pumping the way it should be, causing fluid to back up. It's a classic textbook sign of fluid overload or right-sided heart failure. Wow, we have covered so much ground, so let's boil it all down into one final, simple cheat sheet. This is the stuff you absolutely need to commit to memory, both for your exams and for your clinical practice. Let's recap. The whole purpose? It's to establish that baseline, detect changes early, guide the care plan, and ensure patient safety. And the order? It is always systematic, from the general survey all the way down, with that one major exception. For the abdomen, we always auscultate second. Sticking to that systematic order saves lives, and it's going to help you crush those NCLEX questions.
Thank you so much for watching ClearPath NCLEX. I've got a question for you. Which body system do you find the trickiest to assess? Is it telling the difference between all the lung sounds? Or maybe remembering all the spots to listen to the heart? Drop a comment below. I really do read every single one. Let's help each other out. Seriously, you are doing an amazing job. Just keep practicing and remember that you've got this. If this explainer helped you at all, please give it a like, subscribe for more, and I will see you in the next one.